Hi, this is Denise, and welcome back. If you're new to my channel, welcome and subscribe. So let's get right into it. So this video is going to be, I guess I would title it like biomedical interventions. And essentially what that is just all of the medical and alternative therapies that are done to treat and help with the symptoms of autism. So oftentimes when you're newly diagnosed, most people just tell you to do like ABA therapy or speech therapy, or they tell you nothing. They just tell you, good luck and send you on your way. But what biomedical is, it really addresses the medical and underlying medical conditions that autistic children have. So you're going to get, physical therapies, and it's going to involve supplementation. It's going to involve, non-traditional therapies to help with those things, because what most people still don't seem to understand is that autism isn't a behavioral disorder. Autism is a medical disorder. You have underlying medical issues with these kids that are displaying itself as autistic symptoms. So if we can address those conditions, those medical conditions, and treat them, theoretically, we can reverse them if it's treatable. And if we can reverse it, then we can move closer to recovery. So anyway, one of the first things I had to figure out on my journey was that I needed to find a MAPS doctor. A MAPS doctor is going to be a physician that, specializes in biomedical interventions. And essentially what a MAPS doctor is, what it stands for is Medical Academy of Pediatrics of Special Needs. And that's just a fancy term for a doctor who specializes in the medical issues with children with autism. And that's what you're going to need, because unfortunately your regular schmegular, pediatrician, Dr. Jones or Dr. Smith isn't going to have the capability. They're not going to have the knowledge. They're not going to have the techniques. They're not going to have the resources. One, because they're not trained, and then two, they just don't have it. They don't have the time to dedicate and to give you what it is that you're looking for effective treatment for your kid with autism. And I had to learn that. But there's several great medical MAPS doctors out there, and you just have to you have to seek them out. And unfortunately, these doctors are going to be a little bit more expensive than your typical doctor. And again, because they are so specialized and detailed in your child, they're going to look for, they're almost kind of like detectives in a way. And they spend so much more time than your typical doctor does. So most pediatricians have about maybe 30 to 60 patients a day, and they may spend an average 5 to 10 minutes, like actual doctor patient time, not the time that you're in the waiting room, or the time that you're getting, your vitals checked by the medical assistant. The actual time that you're in with the physician is probably like 5-10 minutes. But with a MAPS doctor or a functional medicine doctor or an integrative doctor or a naturopath, because they're all kind of do the same thing, they're going to spend maybe up to an hour or 2 hours with you, actual patient care time. And it's because they use so much time in investigating and finding out about your child, because as we know, with children on the spectrum, every single child is different. What's going on with my child may not be what's going on with your child. What my child needs is going to be completely different than what your child needs. And they're going to investigate. They're going to figure out, okay, what the root cause is. Like, they're going to figure out, okay, what is the issue with you? Is it poor gut health? Is it environmental factors? Is it a vaccine injury? Is it some sort of like underlying bacterial or underlying infections that you're dealing with? Is it Lyme? Is it strep? Is it Clostridia? They're going to be on the front lines investigating that. And unfortunately, like I said, the regular pediatrician, they just don't have the skill set to do that. So anyway, these doctors, like I said, they're going to be a little bit more expensive. They're going to spend a little bit more time with your child, actually a lot more time with your child, and speaking with you. They're going to ask you like your health history, your family health history, grandma and auntie, and they're going to go even further back. They may even ask, for certain testing that they want done, which is pretty typical Most of these physicians, they're going to have, a level, they're going to have certain tests that they want done, whether it be urine test or stool test or blood test, but those are going to be so beneficial to get done because, again, you're using that magnifying glass and you're looking closer in at that child. You're trying to find out, okay, so why are they constipated? We're not just going to treat constipation, we're going to find out why they're constipated and get to that. They're going to figure out why this child is, so irritable and so aggressive, or why they're not speaking. And these tests are going to help kind of peek in and look further. Is it a nutritional deficiency? Is it, low glutathione? Is it high oxidative stress? Is it a mitochondrial issue? Those tests are going to give you more pieces to this giant puzzle that we're trying to figure out. So a couple of things that I would tell most people when they get started, you find your MAPS doctor or a functional medicine doctor. And for some of them, the appointments could take a long time. Some of them are booked out for the year, where you may call up today and you may not be able to get an appointment in until 6 to 8 months from now. But don't be discouraged. Make the appointment. Because like I said, you're going to need them on this path, on this journey to recovery. But in the meantime, while, let's say, you're waiting to get your appointment, you can be doing things at home that don't cost anything. And the first thing I'm going to say is obtain your child's medical records, meaning get copies of every single thing, immunization records, treatments that they've had, medications that they've been on, every single thing from the doctor's office. You want to get all of their medical records because you want to have those copies. You want to have them with you. The second thing you can do is try to track their developmental milestones. So you can Google, right? I think the CDC has, a website. CDC has a website, and you can go to the website and you can print out, typical, traditional developmental milestones. And then at that point, you can then plug in certain areas. So if, your child started walking at 12 months, you put that down, even though perhaps maybe the normal developmental marker for that would have been much sooner. But you want to go ahead and start writing those things down and start thinking about those things, because it's going to be a minute. If your child's 12, you may not remember, when they first held their head up. I know my child was much younger, and it took me a minute to really when did he start talking, or when did this start? I don't remember, but you're going to have to sit back and think about those things, because these are the questions that they're going to ask you when you go to your appointment anyway. So you might as well get all that ready, because again, these doctors are not, they're a little bit more expensive, and you don't want to spend that time in their office dilly-dallying. You want to get to the nitty-gritty of everything. And if you can kind of already have those things addressed, that's going to be to your benefit. The second thing I would say, the third thing I would say would be to change your diet. I've been saying this forever, and I'm going to keep saying it until people keep doing it. But that's what you want to do. That doesn't cost anything. You don't need a prescription to change the diet. You don't need to call nobody to change the diet. I'm telling you right now, change the diet. The diet is going to be probably, the best thing for you to do to get your kid on that road to recovery. And these doctors, they're going to tell you the same thing anyway. And I'm telling you for free. They're going to tell you to change your diet. So if you haven't already done so, get rid of wheat, get rid of the dairy, get rid of the soy, get rid of all the processed foods. And I know it's going to take steps for some of these kids. It's not going to always be just cold turkey. You may have to do it in phases, but go ahead and just start. And then write down all of your concerns for your child. So if you have a child that's not speaking or not sleeping or is very aggressive or whatever the issues are, write all of that down. That way when you do meet with those physicians, you can address those and you don't forget them. You'll address them accordingly. And then also write down what your goals are. If your goals are you want them to talk, or you want them to walk, or you want them to stop smearing poop all over the walls, whatever your goals that you see for them, let them know. That way, again, they can prioritize and they can address them accordingly. And then speaking of priority, because when you go to these physicians, they'll give you a list of things to do, or they'll give you what they have as their proposed treatment plan. But you may see this, and in reality, you're like, okay, well, how am I going to do this? Or how am I going to afford this? I mean, that's the time to speak with them and say, hey, I want to get all these issues addressed, but this is what I'm working with. how can we, make it all work in something that'll be practical as the parent, as a caretaker, to be able to do. I mean, some of it, yeah, it's going to be like, I'm just going to have to buck up and find a way to get it done. Or it's like, listen, we'll do this now and then we'll wait and do this next. And that includes some of the testing. Some of the testing that they ask, that they require to get more information about your child may not necessarily be covered by insurance. Some of them are, but not all of them. And again, you may have to break it up or piece it together. Like, we'll do this test first and then we'll wait a couple months and we'll do this one next, or what have you. But use them. They're your partner, okay? Because again, this whole process is about empowerment. It's about taking your power back, because you know your child better than anybody. Better than anybody. And they're going to be your guide. They're going to be walking alongside you. So if you're like, listen, you want me to do this, and this, I can't do that, or I can't afford that right now. So, give me the Walmart version. That's what I need. Don't give me the Target version. Give me the Walmart version of this stuff, so I can actually, make it happen realistically. And then the other thing that you can expect during this process of, having, your appointment with your MAPS doctor and doing biomedical, is that they're going to be some supplementations that they're probably going to request that you do. And again, looking at lab work and looking at your child from a holistic point of view, because much of medicine, especially traditional conventional medicine, is compartmentalized. But when we're talking about autism and biomedical and healing and recovery, we have to look at the whole picture. And supplementation, after doing a lot of testing, you'll see where there's nutritional deficiencies, or you'll see where there's, environmental things that have caused, disruption within your child's body. So oftentimes they're going to be deficient, or they're going to have challenges with their methylation pathways and all of these things. And the supplementation is going to help. So things like fish oil, things like vitamin D, things like magnesium, things like calcium, things like zinc, they may, ask you to get. And there's different brands, there's different types, and not every kid is the same. Not everybody's going to, do well on the same type of supplementation. But that's going to be the parent's job, I would say. So, and what I'm saying is like, okay, you can put Jimmy on this type of probiotic, but he may not respond as well to that as maybe another one. And that's when your detective skills, and that's when your note taking and journal taking is going to come in as a parent. Throughout this process, I have learned to be so detailed oriented. I thought I was before, but I wasn't. But to be so hyper vigilant and so detailed oriented when it came to how my child responded to various things, whether it be food or supplementation or the environment, is understanding them a little bit better. I learned to take copious notes. I learned to keep food journals. I learned to keep supplement journals, because, he may take this probiotic, but then it might make him go, it might have a different type of effect on him, or it might have no effect on him. And the only way to really know is that you're paying attention and you're taking those notes. Because again, this is what the doctor is going to use. They're going to use, the information that you give them. So it's important that you're keeping track of those things. And again, with a lot of the supplements that they give you, it may not be covered by insurance or Medicaid. So you want to look into those things when you're having those discussions with them, when they say, hey, we need you to go on XYZ, and you're like, okay, is it going to be covered? Or can we do this instead of this one, because this one is covered? So it's a working relationship, and it's a partnership that you're going to have with that doctor. But it's definitely, the way to go. That's going to be, the takeaway from this. So hopefully this video is helpful. If you have any questions, please leave them below in the comments. Again, please subscribe. I have a lot more to share with you. I have a lot more videos, because this conversation, it's going to involve more videos, especially when we start getting into testing and supplementations and what type of supplements and etc. So again, hope it was helpful, and I'll see you again soon. Thank you.